Botox for the treatment of overactive bladder, or OAB. What you need to know prior to this minimally invasive procedure. Let's talk about what overactive bladder is, or OAB. OAB is the urgency to urinate with or without leakage, usually during the day and nighttime frequency. It can be caused by a variety of different conditions, neurologic problems like multiple sclerosis, spinal cord injury, but it's commonly seen in patients without a known cause. Conservative therapy with fluid restriction and dietary changes is important to make early. It's important to follow your pad usage and know where all the bathrooms are, which is so hard. Staying home to be close to the bathroom and not doing activities you enjoy can also be challenging. In treating overactive bladder, medical therapy is the first step. But if this fails, Botox may be one option that's offered to you by your doctor. What are the indications for Botox? So patients with overactive bladder symptoms that have not responded to conservative and medical therapy, or patients with overactive bladder symptoms that cannot tolerate medical therapy or candidates. How does it work? So Botox calms the nerves in the bladder that cause the muscles of the bladder to be overactive. Since its approval in 2013, it's been used in over 60,000 people with overactive bladder successfully. Botox usually lasts about 6 months, and since it's temporary, the procedure does need to be repeated. After receiving a Botox injection in the bladder, you can expect a few things. There's often a decrease in frequency of urination and leakage episodes, usually by 50% or more. These effects from the Botox are usually seen by 2 weeks after the injection, and the effects can last up to 6 months. The most common risk following Botox is urinary tract infection. Some patients report some burning or painful urination, but this is in less than 10% of patients. Urinary retention, or the inability to empty the bladder successfully, which may require a catheter or self-catheterization, is only noted in about 6% of patients. There are patients that should not receive Botox, so patients with ALS or Lambert-Eaton syndrome. Patients with myasthenia gravis may also not receive Botox because it can affect breathing and swallowing. The procedure only takes about 45 minutes, including the anesthesia time. Your doctor will determine with you what type of anesthesia you should have. During the procedure, lidocaine will be placed in the bladder for 20 minutes to let the bladder be anesthetized and relax. Once the anesthesia takes place, the doctor will then place a small lighted instrument called a cystoscope into the bladder through the urethra or urine tube. During the procedure, the bladder will be filled with sterile water, and then very small injections of Botox will be placed into the bladder wall. This injection process should only take about 5 to 10 minutes. After the procedure, you will have a post-operative appointment about 2 weeks after the procedure to check on how you're doing, how your symptoms are improving, and to ensure that you're emptying your bladder well. To prepare for the procedure, your doctor will have you obtain a urine culture to make sure there is no infection present. Your doctor will give you antibiotics to take around the time of the procedure to help prevent infection, and your doctor will decide on the dose of Botox you will receive. If you receive Botox for any other reason, you need to tell your doctor, as there's a maximum dose allowable within a 3-month period. Because the procedure is done under anesthesia, you will need to fast starting the night before the procedure. Certain medicines, like blood thinners, may need to be held for days to a week prior to the procedure. You'll have a preoperative exam, including blood work, potentially an EKG, to be done by your primary care physician. You will need to have a ride home from the procedure, and a responsible adult needs to be available for the first night after the procedure. Your doctor will tell you if you require anesthesia and whether this can be done under local anesthesia or not. The procedure is usually performed in the urologist's office or in the ambulatory surgery center. These are usually adjacent to the urologist's office or in close proximity, and these are centers specifically designed for outpatient procedures. Some patients may need their procedure performed in a hospital because of medical conditions they may have. Before you're discharged after your procedure, you'll be given prescriptions for an antibiotic and maybe a pain medication. You may experience some burning with urination and even see some blood in the urine, and this can last a few days. You may resume normal activity within 24 hours after the procedure. It's important to let your doctor know if you have inability or difficulty urinating following the procedure, if you have a fever over 101.5, if you have blood in the urine that doesn't go away or prolonged pain in the bladder or if urination. If you have nausea or vomiting or severe pain at all, it's important to call your doctor. The pre-authorization process is important prior to the surgery. We will communicate with your insurance company to determine what your coverage is and if you have any co-payments or deductibles. We'll provide you with an estimate of any charges that you may incur, and all charges are due prior to the procedure. Payment plans are available. A surgical scheduler will then give you a date of the procedure. You may need medical clearance with your primary care physician or internist that will include a history and physical exam. You may require additional testing like blood work, a chest x-ray, or an EKG. You will receive a letter with all of this information about where and when to report for your procedure. In terms of preparing for the procedure, if you require anesthesia, you should not eat or drink after midnight. One of our nurses will call and discuss your medications with you in terms of what you take the morning prior to surgery. If you're on a blood thinner, it's very important to let your surgeon know, as special precautions may need to be taken. Never stop your blood thinners without discussing this first with your primary care physician. Medicines like aspirin, Plavix, Coumadin, Xarelto, Eliquis may need to be stopped. Please arrive early for your procedure at least 1 hour prior. If you're receiving anesthesia, make sure that you have a ride home and that person can stay until you're discharged. We do hope that your procedure goes well and that you have a speedy recovery. We greatly appreciate your feedback regarding your procedure because we're always trying to improve the care that we provide our patients. If you have any questions regarding your procedure or your recovery, please contact your doctor. Thank you.